Well, Obamacare regulations are starting to hit the fan, and Obama's signature law is riddled with costly mistakes and a slew of unmet deadlines. With more, Avik Roy, senior fellow at the Manhattan Institute and former health care advisor to Mitt Romney, Dr. Scott Gottlieb, resident fellow for the American Enterprise Institute. I should say Avik is actually worked with Romney, correct?
Yeah, well, we both did, actually.
Oh, okay. Well, it's everywhere then. All right, I want to start with something that came out from the American Action Forum, and that was a new study that finds the Obama administration has missed nearly half of the regulatory deadlines in Obamacare. Normally, there's time for consumers to opine, for people to get involved in the conversation. Those time frames have shortened. Avik, what do you make of this?
Well, it's pretty simple. You know, if you want to take over 1/6 of the economy, it's hard work, and you can't do it with just a couple dozen bureaucrats in Washington. And so it's not surprising at all that implementation has been sloppy and rough. And I think that's going to continue. And where it's really going to hit people is when they think that they're getting new coverage, and that coverage is going to cost enormous amounts of money. The cost of insurance in the individual market is going to skyrocket by as much as 100% for young people looking for insurance who are trying to buy it for themselves.
What do you make of this, Scott?
Well, if you go to regulation.gov, there's 3 regulations related to Obamacare that have their comment period due at the end of Christmas. The administration really hasn't given people time to comment on these major rules. They've only given them 30 days in many instances, and major rules should have at least 180 days. So they're trying to get this done very quickly, right around the holiday.
We'll know what it means when we read it, okay? You know, when we pass it, we'll figure out what we said. You know, I know you guys have somewhat different ideas about the possibility of Obamacare remaining the law. Avik, let me start with you. Is the Republicans have constantly talked about repeal. Is that even a possibility at this point?
I mean, nothing is impossible, but I think it's really, really hard. I mean, you basically have to, once the subsidies and the trillions of dollars of subsidies start to flow through the system, how do you take those away from people? I think we know, because we try to do that. You know, we try to change Medicare in small ways. We try to change Medicaid in some ways. It's really hard to do. But what you could do, I think, in theory, is use the exchanges as a path for reforming the broader healthcare system in a better way. You'd have to do a lot to change the way Obamacare works.
Scott?
You'd have to change the structure of the federal law. You'd have to allow states to offer any plan that currently operates in the state, perhaps, into these exchanges. The problem with the Obamacare exchanges is that it tightly regulates what plans can go into those marketplaces, so they're not true markets.
These are insurance exchanges.
These are the insurance exchanges that are going to be offered on a state-by-state basis.
Some of the states, not all of them, though. Well, some of them are saying no. Let me move you guys on to another story, though, here quickly that we've been following that I think you both find interesting. It's a new report from the Health and Human Services Inspector General finding incredible waste and mismanagement in Medicare. Take a look at these numbers. Cost to suppliers, $191. Medicare pays $919. Just unbelievable numbers of waste, fraud, and abuse. Scott, to you first. What do you make of this?
Well, it's very hard to exercise a program remotely from Washington. All the utilization review in Medicare is done basically with paper audits. It's not a good way to manage compliance. There's going to be an equal amount of waste in the Obamacare program. They're not going to be able to guarantee eligibility, to certify eligibility for people.
What's a better way?
To administer this at a local level, where you can have private companies or locally derived companies actually looking over utilization, looking over the care that's being delivered.
The thing is, it's easy to waste other people's money. If it's your money, you're not going to waste it as much. And I think that's the problem. Put seniors in control of their own dollars and they won't waste it. But if it's $1 trillion ATM where the government's just rubber stamping these checks to doctors and hospitals and criminals, really, who are exploiting the system, of course there's going to be a waste. So there's nothing that Washington can do to change it unless they devolve the system back to the individual.
We've got to have major reform of health care, and Obamacare really didn't do that. It seems to me it made some of the problems worse, not better.
I think that's right. But now it's there. We're stuck with it. We've got to see what we can do. If we have to step back, we do this in the investment community all the time. We say, starting from today, regardless of what happened before, how would we change? What would our portfolio look like today? Same with healthcare. We got to look back and say, look, Obamacare is the law. How do we take what the whole system is and try to do something?
Scott, quickly.
The problem here is that the structures in healthcare are changing, perhaps permanently. You're seeing so much consolidation in the marketplace. It's going to be very hard to go back and then try to implement a market-based reform on top of that.
Avik and Scott, thanks for coming on. This is a fascinating conversation to me. We cover Obamacare a lot. It's great to have you on set. Happy holidays.
Thanks, you too.
Christmas.